Hi everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Before we jump into today's topic, I want to highlight another important disease that carries a significant symptom burden and seriously affects many patients' quality of life: eosinophilic esophagitis, or EoE. Since eosinophilic inflammation in the esophagus was first described in the 1970s, physicians and scientists have increasingly recognized how common this condition actually is and how often it was previously missed. With the publication of the first formal consensus recommendations in 2007, we finally had a standardized definition and diagnostic framework for EoE. What was once considered rare and mainly described in case reports is now a regular diagnosis in GI and allergy clinics, in the emergency department with food infections, and in patients waiting for endoscopy. Even with this growing awareness, it is very likely we are still only seeing the tip of the iceberg of EoE cases. EoE is a chronic allergen-driven disease of the esophagus, characterized by symptoms of esophageal dysfunction and an eosinophil predominant infiltrate in the esophageal tissue. EoE affects both children and adults with signs and symptoms such as trouble swallowing, food impaction, and persistent esophageal inflammation. When diagnosis is delayed, disease is not adequately controlled, or there are gaps in care, EoE often progresses from a mainly inflammatory condition to a fibrostenotic phenotype, meaning scarring, strictures, and narrowing of the esophagus in many patients. For each individual with EoE, truly effective management requires more precise, targeted therapy. Today, we're taking a deep dive into Eohilia, the first and only FDA-approved oral treatment specifically developed for eosinophilic esophagitis. This medication is formulated to coat the esophagus directly, delivering topical anti-inflammatory steroid therapy right where eosinophilic inflammation occurs. According to the latest 2025 updated American College of Gastroenterology clinical guideline for EoE, swallowed topical steroids are recommended as one of the initial treatment options, and Eohilia is one of the therapy in this category, offering meaningful benefits, but also coming with important limitations that we need to understand. So, what should you know about Eohilia? In this episode, we will cover 5 key points: its indication, how it works, how to take it, the main warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Eohilia and who is for? Eohilia is an oral suspension of budesonide, a corticosteroid formulated to coat the esophagus and reduce local inflammation. It was approved in February 2024 for adults and pediatric patients 11 years of age and older with EoE, and it is indicated for 12 weeks of treatment. At this time, its safety and effectiveness beyond 12 weeks have not been established, so long-term use is not part of the current FDA-approved labeling. Because EoE is a chronic condition, a 12-week course may feel relatively short. However, I would frame Eohilia as an approved evidence-based induction therapy, a way to achieve histologic and symptomatic improvement upfront. Before starting Eohilia, I strongly encourage patients and families to sit down with their prescribing specialist and map out the overall strategy for their disease. Whether Eohilia is appropriate, how it fits into that plan, how response will be monitored, and what the next steps will look like once Eohilia treatment ends. Second, how does Eohilia work? Eohilia contains budesonide, an anti-inflammatory corticosteroid. Once swallowed, the viscous suspension coats the esophageal lining and delivers localized steroid activity directly to the inflamed mucosa. Inflammation is central to the pathogenesis of EoE. Corticosteroids, like budesonide, have a broad range of inhibitory effects on multiple cell types, such as mast cells, eosinophils, neutrophils, macrophages, and lymphocytes, and on inflammatory mediators, including histamine, leukotrienes, and cytokines. By dampening this inflammatory cascade in the esophagus, budesonide helps reduce eosinophilic infiltration, calm tissue inflammation, and improve symptoms such as trouble swallowing over time. Third, let's talk about how to take Eohilia. For Eohilia, proper administration is crucial for safety, absorption, and clinical effect. The recommended dose is 2 mg orally twice a day for 12 weeks. Each unit dose packet contains 2 mg in 10 ml of a cherry-flavored viscous suspension. Before opening, shake the packet well for at least 10 seconds. Then cut along the dotted line straight across the top and squeeze from the bottom to the top directly into the mouth, repeating 2 to 3 times until the packet is empty, and swallow all of the suspension. Eohilia should not be taken with food or liquid. After each dose, do not eat or drink for at least 30 minutes so the medicine can coat the esophagus entirely. Once 30 minutes have passed, rinse the mouth with water and spit out the contents without swallowing to help reduce the risk of yeast infections in the mouth and throat. Avoid using Eohilia together with CYP3A4 inhibitors, such as certain antifungal drugs or HIV medications, because they can increase systemic Eohilia exposure. Grapefruit juice should also be avoided during treatment for the same reason, as it inhibits CYP3A4 and can raise steroid levels in the blood. Detailed step-by-step instructions for Eohilia are provided in the Instructions for Use section of the package insert and on the official website. Always review your full medication and supplement list with your healthcare provider to make sure Eohilia is used safely and to screen for potential drug interactions. Fourth, let's review the warnings and precautions for Eohilia. Even though budesonide in Eohilia is designed to act locally in the esophagus, it is still a corticosteroid, so systemic steroid effects may occur. The prescribing information highlights several key areas to keep in mind. First, long-term steroid use can lead to hypercorticism, meaning too much steroid effect in the body, and adrenal suppression, where the adrenal glands do not make enough natural steroid hormones. If you notice signs and symptoms that may suggest excess steroids, such as acne, easy bruising, rounding of the face, ankle swelling, thicker body or facial hair, a fatty pad or hump on the upper back, or new stretch marks. Or if you feel unusually tired, weak, dizzy, nausea, or vomiting in a way that might suggest adrenal suppression, it is important to tell your healthcare provider. Adrenal suppression becomes particularly important during times of stress, such as trauma, surgery, or infection, when the body normally needs extra steroid hormone. Your doctor may need to check adrenal function and, in some situations, provide additional systemic steroids in those stress situations. Patients with moderate liver impairment can have higher systemic exposure to budesonide, which raise the risk of steroid side effects and adrenal suppression. These patients should be monitored closely. In severe hepatic impairment, Eohilia is not recommended. Second, because corticosteroids suppress the immune system, Eohilia can lower the body's ability to fight infections and increase the risk of viral, bacterial, fungal, and parasitic infections. Some infections may be mild, but others can be serious or even life-threatening, especially with higher or prolonged steroid exposure. While taking Eohilia, your healthcare provider should check you closely for infection, and you should contact your provider right away about any signs of a new or worsening infection, such as fever, chills, new pain, diarrhea, cough, worsening fatigue, nausea, or vomiting. The package insert also calls out several infections as special concerns: tuberculosis, chickenpox and shingles, measles, hepatitis B, fungal infections, herpes infections, and parasitic infections such as amoebiasis, strongyloides, and malaria. If you have or had any of these infections, are a carrier, or have relevant travel or exposure history, review this with your physician. Depending on the specific condition, your doctor may recommend additional testing, preventative measures, or may advise stopping or avoiding Eohilia. Third, if you're switching from another steroid regimen, such as systemic corticosteroids or other swallow steroid formulations, to Eohilia, that transition needs to be managed carefully. Rapidly tapering or stopping a higher dose of a steroid and moving to Eohilia can trigger steroid withdrawal or allow previously suppressed conditions like allergy nose or eczema to flare. Your doctor may choose to taper the prior steroid gradually and monitor for symptoms while introducing Eohilia. In addition, like other corticosteroids, Eohilia may slow growth in pediatric patients, so growth may be monitored while a child is taking the medication. For patients with underlying comorbidities, such as hypertension, diabetes, osteoporosis, stomach ulcers, glaucoma, or cataracts, or family history of diabetes or glaucoma, Eohilia may have unwanted effects. These conditions warrant closer follow-up and an individualized risk-benefit discussion. Lastly, Kaposi sarcoma has been reported in patients receiving corticosteroid therapy, typically in the setting of treatment for chronic conditions. Any new or unexplained skin lesions or changes should be evaluated by a healthcare professional. And finally, let's talk about the side effects and safety of Eohilia. In clinical trials involving patients 11 years and older, the most common side effects included respiratory tract infection, fungal infections of the mouth, throat, and esophagus, headache, infection of the stomach and intestine, sore throat, adrenal suppression, and acid-related damage to the lining of the esophagus, also known as erosive esophagitis. Many of these events occurred in relatively small percentages, and rates were often comparable to placebo. But there are a few reactions with special attention. First, localized fungal infections with candida in the mouth, throat, and esophagus, often referred to as thrush, were observed in some patients. This is why it is important to rinse the mouth with water and spit out the contents without swallowing. If localized candidiasis develops, your doctor may treat with local or systemic antifungal therapy and consider stopping Eohilia. Second, although uncommon, Eohilia can cause erosive esophagitis. Tell your healthcare provider if you notice new or worsening heartburn, chest pain, or trouble swallowing. Further evaluation, including endoscopy, may be needed. Third, post-marketing data with oral budesonide products have reported serious hypersensitivity reactions, including anaphylaxis, as well as benign intracranial hypertension and mood swings. While these events are rare, patients should be aware of them and seek immediate medical attention if they develop symptoms suggestive of significant reactions, such as hives, swelling, or difficulty breathing, or severe headaches and emotion changes. Fourth, based on animal data, budesonide may cause fetal harm. Female patients of childbearing potential should inform their healthcare provider about any known or suspected pregnancy. Overall, when used as directed, Eohilia has a predictable and manageable safety profile, especially when patients and caregivers pay attention to steroid effects, adrenal function, and infection risk. And there you have it, 5 key facts about Eohilia. The first FDA-approved budesonide oral suspension designed specifically for EoE. For patients living with difficulty swallowing, food impaction, and persistent esophageal inflammation, Eohilia offers a targeted esophagus-directed therapy with clinically meaningful improvements in both symptoms and histology. Used thoughtfully as part of a tailored strategy, it provides an important new option in the evolving treatment landscape of eosinophilic esophagitis. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.